Welcome to the Center for Nursing Research and Innovation at Mount Sinai. Today's brief presentation is about how to write an abstract. So the first thing to know about submitting an abstract to a conference is that every conference has its own unique set of guidelines. So the first thing that you're going to want to do if you're thinking about submitting an abstract to a conference is find their specific guidelines and follow the instructions precisely. So when you look in those guidelines, here are a few things that you want to have an eye out for. The first is the abstract length. So the conference will tell you either a word limit or a character limit. And if it's a character limit, they're going to specify whether that's with or without spaces. Some conferences also have section limits, so they tell you how many words can go under each subheading. Sometimes a conference will tell you that they allow one table or one figure, and sometimes a conference will tell you that the title and author information is going to be included in your total character limit. So read that section closely. The next thing that you want to look at are the required section subheadings. Some conferences won't have any required section subheadings, and you could use whatever subheadings you'd like. Other conferences require specific subheadings be used, and sometimes they will have different sets of subheadings depending on what type of project you're submitting. The next thing to look out for is references. Some conferences require references, some conferences don't allow references, and sometimes a conference is not going to specify. So make sure you know what the rules are with regard to references. And of course, if the conference does accept references, use the standard style that they recommend. Abbreviations. Some conferences will have a list of approved abbreviations, a list of abbreviations that are not allowed, or they'll say that any standard abbreviation is allowed. Some conferences would like for you to submit your abstract blinded. And what that means is that you've removed all of the information that could potentially identify you or your institution. And sometimes a conference is going to be more liberal or more conservative with regard to the types of projects that they accept. So sometimes a conference will only accept research projects or only research QI and evidence-based practice, but sometimes they will allow you to submit literature reviews or works in progress, or, for example, a description of a new model that you developed. So make sure that you read the guidelines to understand whether your project falls into one of the categories that this conference accepts. The next thing to know about abstracts is that essentially they all follow a standard structure. So regardless of where you're submitting your abstract, you're going to find that you're going to be telling a story in these 4 steps. So the first step is telling your audience, why did you do this project in the first place? What was your motivation for conducting the project, and why do you feel it's important? The next step is where you tell the when, where, why, and how you did the project, and also who was involved. The next step is where you tell everyone what happened once you did the project. And the last step is that you tell your audience what you learned and what your takeaway messages are as a result of the project. So now that you know the generalized structure of an abstract, we can start to talk about where some of the different subheadings can fall. So first, we'll talk about that beginning section that tells the reader why you did this project. So in this section, sometimes there will just be one overall subheading that you're asked to use, such as background, significance, or introduction. But sometimes you'll see that this section is further broken up. So you might be asked to, for example, first write your background under one subheading, and then write your aims or your objectives under a different subheading. There are certain words that are more associated with research, such as background, significance, or research question or research objectives. But there's also some phrases that are associated more with quality improvement and evidence-based practice, such as reviewing the local context or the problem, and then talking about the purpose of the project. So just depending on which conference you go to, you may see any one of these words or a combination of these words used to structure your abstract. In the next section, you're going to be asked to talk about the when, where, and how you did this project and who was involved. And again, sometimes you'll get one overall subheading, such as methods, but sometimes they'll be broken down even further, such as material and methods, design, sample and setting, and you'll be asked to break out each of those concepts separately. The next section, what happened once you did the project, this is what's often referred to as either the results or the findings. And lastly, what did you learn as a result of the project? This can be called either the discussion section, the conclusion section, or sometimes you have this broken down even further where they might ask you to specify specifically the implications for practice, implications for policy, recommendations, or other more specific subheadings within. So this table just serves to illustrate that there are many different subheadings or combinations of subheadings that can be used in each of the 4 general sections of your abstract. But the take-home message is that regardless of what subheadings they're asking you to use, you're still going to be putting the same information in each one of those 4 sections. It's just a matter of how you organize it and what subheadings you use to put on top. So while you might find a conference that has only background, methods, results, and conclusions, you might also find conferences that are very prescriptive and have multiple subheadings in each one of those 4 categories. Again, the information that you're putting is basically the same. You just want to follow the guidelines with regards to the specific subheadings that they're using in each one of those categories. So the goal of the abstract is really to tell a story about your work. And for the purpose of this example, we're going to tell a story about a falls prevention program. And the very first thing that we're going to do is tell our audience why we did this project. And the first sentence I always recommend is to give the big picture context outside of your organization. Generally, why is this important? And why would other people care about what you did? So here we have an example about fall prevention. So we can begin by saying that falls are a leading cause of preventable injury in hospitalized patients. Nearly 1 million patients fall in US hospitals every year. 25% of those falls result in serious injury, and 1% of those falls result in death. So we're giving our audience a really good motivation for caring about fall prevention. And one thing that I want to point out is that here we're specifically talking about fall prevention in hospitalized patients. And that's because the project that we're about to describe takes place in a hospital. So it doesn't really make sense to talk about falls in the community if we're dealing with hospitalized patients in this particular project. The next thing that I advise is to narrow in on the focus of your specific project, right? So you've already given the big picture, but now it's time to narrow it in on the smaller picture that you're focusing on. So you can say something like, preventing falls in the post-operative setting can present some unique challenges because patients have potentially limb immobility, muscle weakness, and are recovering from anesthesia. So here you're giving the audience the knowledge that you're talking specifically about how to prevent falls in your setting, which in this case is a post-operative unit, and why patients in this particular unit are really in need of fall prevention. So the next sentence says, while interdisciplinary strategies are optimal for post-operative fall prevention, many hospitals rely solely on nursing interventions. So now you're giving your audience the next clue about what your project is going to do. You're saying this is a problem that we only focus on nursing interventions when we know that multidisciplinary strategies are really the best. So you're setting up your audience to understand where this project is headed. In the last sentence, you're going to tell the audience what you did about this problem that you've just told them about. So in this case, you're telling the audience that you did a literature review to identify, implement, and locally evaluate the impact of an interdisciplinary falls prevention bundle for post-operative patients. So you could see that you're being really specific in this sentence. You're saying that you found an intervention by doing a literature review, you implemented it in your setting, and you evaluated it. So you're telling the structure of the project in this one sentence, and you're also telling a little bit about what the actual intervention is, an interdisciplinary falls prevention bundle for postoperative patients. So this slide just puts all of those words together in one paragraph. So all I've done is zip up those sentences into a single background section. And you could see on the next slide, these are the same exact sentences. I've just separated them out. Instead of having one big background section, I've just put them into a significant section, which is the first two sentences, and then a purpose section, which talks about what you actually did, what your project was about. So you can break this up with any number of subheadings depending on what your conference is asking for, but you'll see that the words and the sentences are exactly the same. You're just either grouping them all together in one section, or you're breaking them out into two or more sections. So this next section is where you tell your audience all about the actual project that you conducted and how you went about it. So here, there's a lot of details that you're going to want to include as they relate to your project. So we'll take it step by step. First, you want to tell your audience when the project took place. So use as precise dates as you can. Sometimes this will be exact days, months, and years. Sometimes it will just be a month and a year, but be as precise as you can. And also make sure to break out any comparison periods that you're going to be using. So for example, if you did an evidence-based project that you're having a pre and a post comparison period, you want to tell the audience what's the pre period and what's the post period that you're comparing. Next, you want to talk about where the project took place. So this is not only about the geography, such as, the city and state where the project took place, but also a little bit about the population. So for the example that we're using here, we're talking about patients who are in a postoperative surgical unit within an inpatient hospital. You could tell a little bit about the size of the unit. Maybe it's an 18-bed unit. You could talk a little bit about the type of hospital and the size of the hospital, such as a large urban academic medical center versus a smaller 100-bed community hospital. So give as much background as you can to describe the setting where the project took place. Next, you want to talk about what type of project it was. So was this evidence-based practice? Was it quality improvement? Was it research? Or perhaps it was a literature review or a model development. Next, you want to talk about the design that you used. So were you doing an intervention such as a randomized controlled trial or an evidence-based practice or quality improvement project that involved a pre-post comparison? Perhaps you were doing an observational study, such as looking at a cohort of patients or a cross-sectional group of patients. Maybe you were doing a descriptive study where you were surveying people to find their opinions and practices, or you were asking people questions in a qualitative interview or focus group. Next, you want to talk a little bit about who were the actual subjects or participants in your project. So how were these people identified? Were there any inclusion or exclusion criteria, etc.? Then you want to talk specifically about any interventions that you may have introduced. This is particularly applicable if you're doing a quality improvement or evidence-based practice project where you're implementing something new. So you want to describe all of the components of that intervention, the details of any training that took place to get people ready for the intervention. Perhaps there were changes that you need to make to your documentation in order to implement the intervention. And you want to talk also about the timing as well, how long it took to do each of these components or train staff prior to the intervention beginning. Next, you want to talk about the data collection. What data did you collect and how did you collect it? And it's good to be as specific as possible. So if you used a survey, for example, talk about whether or not it was a validated instrument, talk about the types of questions that were included. If, for example, it's from electronic health records, be specific about which data fields you collected from those health records. And lastly, you want to talk about how you analyze the data. So, for example, if you were using an instrument, how is that instrument scored? If you're presenting descriptive statistics, talk about the percentages or the means or medians that you're going to be showing. And lastly, of course, if you did any statistical analyses, you're going to want to give the details of your statistical methods as well. So once you've answered all of those questions, it's time to put it all together in a sentence format. And here I've provided one big block method section that we can go through. And I've highlighted key pieces of information that we identified on the previous slide to show you how to put them into this larger context. So in the first sentence, we can see that this is an evidence-based practice project that was conducted on a adult 18-bed surgical unit in a 700-bed acute care hospital in New York, New York. So here we have the type of project, evidence-based practice, the population, adults, the type of unit, an 18-bed surgical unit, the type of hospital, 700-bed acute care hospital, and where the hospital is. So there's a lot of information and a lot of questions answered just in this first sentence. Now we're going to talk a little bit about the actual intervention, what you did. So here we have the unit changed its practice from a nursing falls prevention program that consisted of more scoring and hourly rounding to the multidisciplinary 4Ms approach, which includes the Morse score, the mental status, the mobility, and the medications. So in this sentence, you're telling your audience that it had a practice change where you, instead of having your old method and you tell what the old method was, you're putting in a new method and you're describing what that method is. So next you're saying that you implemented this method and how you did it, right? So you implemented interdisciplinary daily rounds with physical therapy, occupational therapy, medicine, and nursing to address each of the 4Ms and create an individualized plan of care. So this is the action statement. In one sentence, you're giving a lot of information about the new practice and how you rolled it out, who was involved. Next, you're going to talk a little bit about how you got staff on board to do this. So you're telling the audience that staff were oriented to the 4M model and program goals during a unit in service. Next, you're talking a little bit about your analysis and what data you used to do the analysis. So you can tell your audience that you used Poisson regression to compare falls and falls with injury per patient day for all patients on the unit before and after implementing the 4Ms. So let's break this sentence down a little bit more. Poisson regression is your statistical analysis. That's how you did the comparison. And it's important that you write here exactly what you were comparing. So here you were looking at falls and falls with injury, two different measures, but you're telling your reader specifically that you were looking at falls per patient day, not just the number of falls, but you're using a standardized denominator, falls per patient day, which is the way that we typically look at falls in hospitals. Now you're telling your audience that you're including all patients on the unit. So there's no mystery about whether only some patients were included in the analysis and not others. You're saying all patients on the unit were included. And you're giving the pre and post intervention period. So you're telling your audience that the before period or the pre period was January through March 2023, and the post period or the after period was April through June 2023. So there's really a lot of information jammed into this one sentence. And in the last sentence, you're telling your audience where you got this data from, right? Were you collecting it on your own? Were you using a hospital system? How did you actually get this information? So you're telling your audience that data on falls were extracted from the hospital's nursing quality indicators database. So all of that information on the previous slide is summed up in this one paragraph. And just like we had for the background sections, I'll show you that this method section, just like that, the exact same sentences could be broken up into different subheadings. And here we have it broken as the design, the setting, the approach, and the analysis. The sentences are the same, the information is the same. We've just chopped it up a little bit. So our next section is talking about what happened once you did this project. So this is typically our results or our findings section. And here I suggest approaching this in 3 parts. So first, you want to tell your audience how many people were involved in the project ultimately. So in this case, you can say there were 241 patients who were admitted to this particular unit during our pre-intervention period, and 218 who were admitted during the post-intervention period. So really simple, just describing the number of patients involved. Next, you want to talk about the data that you found descriptively for those main measures that you had talked about in the previous section. So you're telling your audience here that in the pre-intervention period, you found 8 total falls and 3 falls with injury per 1,000 patient days. And then in the post-intervention period, you had only 4 total falls and 1 fall with injury per 1,000 patient days. So again, just describing the measure exactly as you reported it in the previous section. You're just giving essentially the answer to the question that you posed. And in the next section, you're going to tell your audience about the results of your planned analysis. So again, in the previous slide, you had said that you were going to make a statistical comparison using Poisson regression. This is the sentence where you tell your audience what the results of that comparison were. And as you can see, you write that you found that there was a statistically significant reduction in the rate of falls following the intervention. And because this is a statistical analysis, it's appropriate to add the p-value for that regression model. And you can do so in parentheses, just like we have here. So here you'll see these are just the sentences from the previous slide summed together in a single results section. Usually the results section or the findings section is only one section. There's no additional subheadings typically. And it also tends to be a pretty short section, as you can see, because we're only giving the facts of our analysis. We're saying what we actually measured or calculated and what the actual analyses showed. We're not going into any interpretation. We're not talking about what we did as a next step. We're just providing the facts of what happened once we did this project. Here in the next section, the last section, is where we get to talk about what we learned and how we interpret our findings. So the first thing that I tell people to focus on is what's the interpretation of your results? In the previous section, you gave the numbers or you gave the statistics. Here is where you can interpret what they mean. So you might start with a sentence such as, this project demonstrated that adopting a multidisciplinary 4M model in surgical units can reduce falls and falls with injury compared with a strategy of hourly rounding and more scores alone. So here's where you actually get to say it worked or it didn't work. And more importantly than saying it worked or didn't work, you're reminding your audience of what it is that worked or didn't work. So here you're reminding them that you did an interdisciplinary 4M fall strategy, you did it in a surgical unit, and it was replacing a previous strategy that was only hourly rounding and more scores. So you're saying, again, kind of what we were comparing, what was the new model, what was the old model, and whether or not the new model worked better at achieving your outcome, which is reduced falls. Next, you can reflect on your findings and make some recommendations. So here you might say something like, surgical units could be particularly well suited to benefit from this 4M model because the 4M model focuses specifically on mobility, medications, individualized care plans, and interdisciplinary support. So you're saying that, your findings are really relevant to the population that you were studying, and that you think that other organizations with similar populations might also find a benefit based on what you saw. Now you want to talk about your limitations and any next steps that you might have for this work. So here you could say something like, your project did not evaluate the sustainability or impact of this 4M model beyond 3 months, right? You only are reporting results for an abbreviated period. Therefore, future work may be required to understand the long-term benefits and the long-term challenges, because again, you're not reporting anything in your Excel results about what happened a year later. Was this a sustainable practice? Did you need any re-education of your staff going forward? So this is an appropriate opportunity to talk about what you might do in the future and also any limitations of what you've presented. And in this case, a main limitation is just that you're only reporting the results for a 3-month period. So just like we've done for the previous sections, here I'm just showing you what those sentences look like zipped up into a single paragraph under a conclusions subheading. And again, perhaps your conference has different subheadings that they want you to use. For example, a separate limitation subheading and a separate implementation for practice subheading. This is the exact same information, the exact same sentences, just split up in a different way. Thank you for joining me on this journey through writing an abstract. I do hope that you found it helpful. And if you did, please check out our other videos as part of the Center for Nursing Research and Innovation collection, including a video on tips and tricks for perfecting your abstract.